Hi, this is Brandon Leonard, Director of Strategic Initiatives for Men's Health Network, and I'm here today at the Veterans and Sexual Health Dialogue meeting, and I'm speaking to Heather Ansley, who is Associate General Counsel for Corporate and Government Relations at Paralyzed Veterans of America. So thanks for speaking with me, Heather.
Thank you.
So Heather, we've just had a good discussion with a lot of veteran services organizations and other groups about this important topic of sexual and reproductive health for veterans. And first of all, could you just tell us a little bit about what you do and what your organization does in terms of promoting veterans' health, particularly for the veterans that you serve?
Certainly. Well, healthcare is critically important for veterans who are living with spinal cord injuries or disease related to the spinal cord. Paralyzed Veterans of America has worked for a number of decades with the Veterans Health Administration to ensure that veterans are able to receive the care that they need. We have staff and volunteers who work to ensure healthcare access and quality for veterans. We know that without access to healthcare and other VA benefits, it's nearly impossible for veterans to be able to live and work and be in the community and do the things that others do.
Great. And can you tell us a little bit about the role of sexual and reproductive health and how that fits into overall health and well-being for the veterans that you work with?
Certainly. Sexual and reproductive health is part of the holistic view of helping veterans who have sustained injuries related to their military service or after their military service to be able to return to their communities and to live and have the opportunities that other Americans do. PVA has been very interested in ensuring that reproductive health opportunities are available through the Department of Veterans Affairs, including opportunities to begin families or to add to families through the in vitro fertilization process and other opportunities that aren't currently there through the VA, because we know that veterans want to be able to add to their families and just like any other Americans do.
And what do you think that the advocacy community can do to help promote the idea of, I guess, incorporating sexual and reproductive health, and what are kind of the gaps that still remain for making sure that's a reality, that people are getting supports and services that they need?
I think that one of the most important things that advocacy organizations can do is to make sure that they're looking at the unique needs of veterans, service members, caregivers of veterans living with catastrophic disabilities, to ensure that there's an inclusive view of the unique needs that they have. I think many times, because veterans are a small percent of our population, they're not included in the general information that's out there. And so we want to make sure that veterans who may not be getting information through VA or other channels are having the opportunity to be exposed to questions about sexual health. So if they're not, those aren't being discussed with them, they can take those back to their healthcare provider or other professionals that they are working with, so that they too can have that part of their health and well-being considered as we look at their overall holistic goals for their futures.
Well, thank you very much for taking the time to sit down and talk with me, and we appreciate you participating in today's dialogue.
Great, thank you so much. We appreciated the opportunity.